Welcome to this month's Minute with Victor, where Dr. Cotton answers your questions.
This month's question comes from a physician who writes, I scheduled a stress test for a patient who was having chest pain. Unfortunately, he didn't show up for the test. He missed his follow-up appointment, and I never saw him again. Then, 4 months later, he had a heart attack. I've been told that I'm at fault because I didn't remind him to keep his appointments. Is the patient responsible for anything? No matter what we do, there will always be irresponsible people out there who make bad choices, then blame someone else for the consequences, and occasionally they're successful. But that's the exception. The rule is personal responsibility. People are responsible for their choices, and that's not just my opinion. Personal responsibility has been the backbone of the rule of law in every civilized society in recorded history, and it absolutely applies to your situation. The only caveat here is that as physicians, we have an obligation to inform the patient so that he can make an educated decision. We're required to inform, and once we've done that, both the choice and the consequences belong to the patient. Now, how do we apply that to your scenario? Here's how I do it. While the patient's still in the exam room, I discuss my concern that his chest pain might be an early sign of a heart attack and that we need to figure it out by starting with a stress test. Then I pick up the chart and write, need for further evaluation discussed, or importance of follow-up discussed, or diagnostic plan discussed. At that point, my obligation to inform has been fulfilled and documented. The patient's free to do whatever he likes, he just can't blame me. You know, I'm constantly hearing that medical paternalism is a thing of the past and that we should never interfere with the patient's decision. But then, as you point out, we're also told that we have to follow the patient around and make sure he takes care of himself, which sounds like medical maternalism. You're free to do that if you like, but from a legal perspective, it's important to draw a distinction between being the patient's doctor and being his mother. Thanks again for listening.